Are we going to do this episode topless or just kidding? Just
I
kidding. Just kidding.
mean, I was actually entertaining the idea because it's just so hot
I know.
today. Um,
That would be distracting.
Welcome to the Coffee Shop AU, a show where we sit down with our favorite drinks and talk about queer things. I'm your host Jay, and today I'm joined by my friend Mo. Hi Mo, how are you? And what are you drinking?
Hi, Jay. I'm great. I'm great on this morning that you got me out of bed. No, actually, this is such a joy, but
On this Sunday morning when you really should be sleeping in. Thank you for doing this.
oh my God, it's a joy. But I'm like, oh God, Jay, how about like 2 p.m.? You're like 9? I'm like 1. You're like 10? Like 12? You're like 10:30? I'm like, all right. The negotiation.
The negotiation.
But it's a joy. And yes, I got a special coffee for a special day. I got chai tea latte with espresso. Okay, dirty chai. There we go. Dirty chai with special milk for the tummies. Yes.
Wait, which milk?
Soy milk.
Oh, okay. Sounds delicious.
Yeah. What are you drinking?
I am drinking like a day-old coffee that I hand brewed.
Oh.
It's like, well, I guess it's like a hand drip. It's like a Vietnamese coffee I got online, just like 100 bags, and it's actually pretty good. I made it yesterday morning, and then I completely forgot to drink it because ADHD. So I'm drinking it today, totally fine, just like fermented coffee.
Yes. I love when it starts to taste like dirt. Then it's the perfect time.
Oh yeah, like soil, all natural. We're already getting a little distracted,
We are.
but that's fine. We need to relax because we're gonna talk about a topic that I think probably a lot of people who are listening to this show specifically can maybe relate to in a really personal way. And it is something that I went through very recently, and it is something that you went through some time ago. And yeah, there's just a lot to delve into. So, are we relaxed?
Are we going to do this episode topless or just kidding? Just
I
kidding.
mean, I was actually entertaining the idea because it's just so hot today.
That would be distracting.
Because we're on a Zoom call. You can only hear our voices, but we are looking at each other. So, like, I mean, Loki, I do have this undershirt on. I got this recently, and it's like a muscle fit. Like, that was the description. So it clings to, like, all the right places.
Yes.
And it does give your torso a really nice shape. And I was just thinking, oh, maybe I should just do the recording just in this undershirt. But then I was like, no, we're close,
No.
but we're not there yet, maybe.
Yeah, well, fine. Fine. But yeah, even though this is audio, we could do a little reveal, because I got to see it.
Oh, to each other. Let's see if we get there. Okay,
God.
if you
I sound like a creep.
if you haven't guessed from our conversation so far, today's topic is top surgery.
Woo.
Yay. So we're going to be discussing so many things around the topic of top surgery. So many things are fresh on my mind because I got my top surgery like 2 months ago. And you were really like holding my hand through a lot of that process. You're amazing. Thank you. So I wanted to discuss it with you. As I said, you already had your top surgery. We got our surgeries from the same surgeon. So we can compare notes, we can compare all of the things that we have felt before, during, after. So we're going to be talking about what it was like for us to live through all the different phases surrounding top surgery, because there's like the whole considering top surgery, actually going in for consultation, making the booking for the actual surgery, and then like that whole purgatory period
Purgatory is right.
where the date is set, but you're like waiting and you're so anxious. And then there's the surgery itself and the whole like recovery post-op process. So we're going to be discussing all of that, and hopefully we can also discuss some tips on how to handle all of the things that can come up in all those phases. There's a lot that I thought I was prepared for, and then I just realized once it actually started coming up, I was like, oh, I was totally blindsided, even though I did like so much research beforehand and I tried to prep as best as I could. So yeah, that's what we're doing today.
Hell yeah.
I'm sure we have listeners who don't know exactly what top surgery is. They might be familiar with like the sound of the words, kind of with the concept. But what is actually what is top surgery? How would you describe it, Mo, as somebody who's had one?
Oh no, am I supposed to make it sound like a dictionary? Because I don't have those words.
No.
For me, it was a double mastectomy, but happy and fun and positive and great. Party time, right?
Yeah.
It was like the positive one. Woohoo! It was chopping off the lumps, chopping them off and feeling great. But I don't know what the dictionary definition is. Maybe you should do that part.
Yeah, I don't know what the dictionary part is, but I'm gonna look it up now.
Okay, yeah.
Basically, the process of surgically changing the shape, the appearance of your chest, right?
Right.
To decrease, lessen, ease dysphoria, and help you feel more comfortable in your skin. So it is basically magic. That is very expensive. Okay, well, I found a dictionary.
Okay.
Let's see. According to denverhealth.org, I'm always gonna read like Google results that are like just the first result that comes
Right.
up. I want to be fair, you know?
Uh-oh.
This is the most fair way to do anything. But I don't have the energy these days. So, according to denverhealth.org, chest reconstruction surgery, also known as I looked up FTM top surgery. So FTM top surgery, female to male top surgery, is a gender-affirming, masculinizing top surgery that removes breast tissue and forms remaining tissue into a shape that is typically considered to be more masculine. I think that's pretty accurate.
That was great. Wow. Thank you to the wordsmiths out there.
Yes. So that's the kind that we both had.
Right.
But there's also MTF top surgery, male to female, or male to non-binary top surgery, MTN. There's a word for that too.
Yeah.
Wait.
Did you know that?
I did not know that. Why don't we get FTN?
Well, we did. But like, maybe I did. But we did, but like non-binary is not as commonly talked about in Korea. So like it's not being spoken of in that way.
Right.
There's just like
FTM. Also because like non-binary is, I think, it's very wide. It's a very broad playground.
Right.
To say non-binary. Like if you say like female to non-binary top surgery or male to non-binary top surgery, what does that mean?
Yeah.
It makes complete sense, and also at the same time, like you said, it's just not really in common parlance in Korea.
Right.
So, okay. Male to non-binary top surgery. This surgery involves, according to healthline.com, using saline or silicone implants to increase chest size and augment the shape in order to achieve a more feminine or female appearance. Yeah, that also sounds pretty damn accurate. Mm-hmm. I actually don't know anybody personally who's had this type. Mm-hmm. But I know a ton of people who've had the FTN... Actually, mostly FTN top surgery,
Right.
rather than FTM, because like most of my trans friends are transmax non-binary people.
Right.
So the actual process that's involved, like just to get a little bit graphic for a minute, is like I had a cis guy friend who asked me, like when I told him that I had top surgery, he was like, "Oh, well, like what does that involve?" And first of all, this is how our exchange went. He was like, "Do you want to smoke?" Because he was going to have a smoke. And I was like, "I can't." And he was like, "Why not?" He was outraged. Like, "Why not? Like, how come you're not smoking with me?" And I was like, "I just had surgery." And he was like, "What kind of surgery?" And I was like, "Top surgery." And he was like, "Oh." And he looked just like really confused. Like, what does that mean? And I'm like, I'm going to show you my scars like soon enough. But for now, suffice it to say, like I flattened my chest. And he was like, "Really? how does that work? Like, what did they do to you?
Yeah.
And I was like, well, I thought you might ask, because we just tend to have like very just all over the place kind of conversations. And I was like, I thought you might want to know. So I actually I kind of low-key did a rehearsal of like how I was going to describe this process of what was done to me, or what I chose to have done to me. And I was showing him where they cut my skin. They cut you here, which is like sort of above like the nippular area, I guess, because I also had full double incision. So there are different types of FTN top surgery, and the ones we had, they open you up the most, right? And they remove the most tissue. So I was like, they cut you here above like the nippular area, and then they cut you down here, like along like the lower chest area, and then they take out all of the fat and the breast tissue, and then they stitch you back up in a way that you really want. And I wanted a pretty cis man looking chest shape. And then if you choose to have your nipples grafted on, they will cut your nipples out of your old skin. And then not just the nipples, they will cut the areolas out to a size that you want, and then they'll like stitch those back on. And then they will also separately cut out the nipples and shave those down if necessary to the size that you want, and then stick those on separately. And he was like, the entire time I'm explaining this, his mouth was exactly like yours. But like he was like, just his mouth was open. He forgot to smoke his cigarette. He was just holding it in his hand and just like looking horrified. And he was like, that sounds so painful. And I was like, I mean, I was out of it. I don't remember. Most of it, it was okay. And he was like, oh, wow. I was like, yeah, if you want, I can show you the scars later. Because I was very much bandaged up at that point. And then he was like, do you want to see my back surgery scar? And I was like, yes.
Of course.
And so he turned around and showed me like 11 shaped sort of surgery scar on his back, because apparently he had lower back surgeries a couple months beforehand and didn't really tell anybody. And he was like, I haven't shown a lot of people this. And I was like, well, I feel honored. Thanks.
Wow.
It was a really great exchange. And then we talked about his ex, who was a cis woman who had breast augmentation surgery, and how he found out about it and how like inconspicuous it was. And I was like, that's fucking awesome. And we just went into a really long, deep discourse about gender and gender affirming surgeries that both cis people and trans people can have, and other gender diverse and gender non-conforming people can have, because we exist.
Sounds lovely.
Tell us, Mo, the wise one.
Oh.
Why do trans people like us, or gender diverse, gender non-conforming people, have these surgeries? It does sound painful if you just like listen to what happens, especially like the double incision surgery.
Yeah. But then when you hear about a person after their surgery, they're like, it's amazing. Yeah. I mean, not everyone, but still. Mostly, I've heard just like people not worried about how much it hurt and just like so happy with how they feel after. But yeah, I think people have these surgeries so that they can feel like their body matches their gender. And probably for many years, their body felt like it wasn't aligning with their gender. And so we just make a few adjustments to feel it in our bodies. Yeah.
Yeah, just a few. Just a couple. Yeah, I think that's beautifully put. That was certainly my experience. I think the best way to describe it is I didn't hate my chest before getting top surgery. I always thought it looked pretty nice, like objectively speaking. But I couldn't connect to it. I didn't feel happy or like could derive joy from having my chest the way that it was shaped. And so I disconnected from my chest a lot. Like I didn't even think about it as disconnect. But then I heard you put it in a way that like I was not really present in my body, or like I was kind of detached from my chest before top surgery. And I was like, oh.
I said that?
I think you said that. Yeah, a couple of times.
I said that about myself or about you?
About you.
Oh, okay. I was like, oh my God.
That would be weird if you were
Imagine.
like...
Jay, let me tell you about you and your connection to your body. I was like, what did I say? It's horrible. Okay, just checking.
No, I think it was, I'm pretty sure it was about you.
Okay.
And yeah, that would be like red flags just like everywhere. We would not be sitting here together. But when I heard you describe your experience using those types of words, I was like, oh, that is also my experience. That was my experience. That is how I would describe my own experience of like being in my body and looking at my chest. I would just always look at it and like acknowledge that they are there, but also like ever since I found out that top surgery was a thing, in my mind they were gonna be gone at some point for sure. You know, so this is just like temporary, and I don't think that I worried too much about how much it was gonna hurt. I haven't heard a lot of people discussing that. I think for a lot of people, the financial aspect of it can be a stressor. If you live in a country like Korea where it's not covered by insurance. Even then, though, like people can spend years saving up.
Yeah.
And it typically takes quite some time afterwards to recover. And sometimes you have complications or side effects. So, like, I think mentally it is a lot to think about and process. But all of that is, like, weighed out by how much discomfort. For some people, it's, like, an active discomfort, like, all the time.
Yeah.
And it really lowers the quality of their life. For other people, it can just be like, I just don't want this. This is not what I want. And I want something better. And I think that was me, you know? I was like, if I had to live like this, I could, but I wouldn't be happy.
I was more the first one where I was like, these are not mine. I'm 100% sure that I would be happier without them. But, like, I was still worried about, like, oh no, like, how's it going to be societally if I do that? And, like, of course, money. But I was never worried about the pain. Never.
Yeah.
Because it didn't matter compared to the other stuff.
Right.
It was like, it's fine. We'll get through it.
Like the spiritual pain. Yeah. Yeah. I follow like several transmask YouTubers, people who have YouTube channels who are also transmask, who have had top surgeries. And like everybody's stories are a little bit different, obviously. I watched one YouTuber, I think his name is Noah Fince.
You say Trevor Noah? No, just kidding.
Yeah, I literally said Trevor Noah. I was like, Trevor Noah, transmask.
Okay, wait.
We love to see it. Noah Fince is the YouTuber handle, so I think it's a play on words to say like no offense.
Okay.
But his name is Noah, okay? And what did he say? He was like, I never showed my chest to my boyfriend before top surgery. And I was like, yes, totally makes sense. But he was like, I did take like a picture of my chest right before my surgery because I was like high or drugged or something, like legally. And he was like, oh, look at these. Or something like that. And I thought that was pretty funny. Like, that is not something I would do. I don't know. Did you take pictures of your chest like before surgery at any point?
I have never in my life taken a nude. And that is, I'm like, wow, that's weird. Everyone takes a nude when they're younger, but I never took a nude ever. I was like, ooh, God. But I was like, oh, I'm gonna wonder, what did those look like? Because, like, I don't have any pictures of them. And so I was like, I'm gonna need to know. So I did take one photo, and I put it in my little hidden folder on my phone. Because I was like, it'd be nice to remember what they looked like, just for context. And yeah, wow, they're giant. They were giant.
Giant?
Yeah. Not a fan of them, but they were giant.
Okay. So, like, do you periodically, like, look back on this picture? Or have you ever looked back? Okay.
I saw it when, like, because I went into that folder for the scar pictures when you got your surgery. And I was like, let's share pictures. I was like, yes.
You're like, let's do a photo swap.
So, like, I don't have just, like, my scar pictures in my photo album because that can be a bit shocking to be, like, scrolling through if I'm just, like, in public.
Yeah.
So I put those, like, in the hidden folder, just to spare the others. And then right before it was that picture. And I was like, whoa! But no, I don't go back and just look at it.
I have heard people talk about how like some people will just feel a little bit weird about the fact that it's not there anymore. And I think this really varies from person to person. And I remember asking you like if you felt at any point felt strange that your old chest wasn't there anymore. And you're like, no. What did you tell me?
I was about to ask, what did I say? Because I think no. If you ask me right now, no. I'm like, wow.
Yeah, you said no.
Feels right now. Okay.
It's like, no, never. Yeah, you said it felt correct.
Yeah.
Not to have them. Mm-hmm. Yeah, and I think like I'm also in a similar camp of just like, I don't miss them. I was fond of them, but, you know, also like happy with my new chest as well. Like this doesn't feel weird or new even. I'm just like, yes, finally I can actually see my real chest.
Yeah.
That was hidden underneath the skin suit. And I think that's something that like a lot of people, cis people, might not understand, or maybe they do, you know, like a lot of people have augmenting surgeries.
Yeah.
Yeah, a lot of people I think can relate to this feeling of like, I know my body's supposed to be a certain shape. I'm gonna do something to have my body be that shape. And when it turns out like the way you think it should look like, you're like, oh yeah, yes, this should have been the case all along.
Mm-hmm. That's so kind of you to talk about your chest fondly, both before and after surgery. Good job. That's great.
Yeah, no, I literally do. Thank you. I love getting compliments on how kind I am. I think that's one of the best compliments you can get as a human being. I also think you're extremely kind, just in general. Is it hard for you to like describe your old chest in that way?
In what way?
I guess in a like a kind or positive, supportive way.
I guess
Like, how would you describe it?
I guess not now, but for many years, I guess I would take words like what you genuinely felt and like use those to replace the things that I was actually thinking. And then eventually it became true. So like I did deep down really have an issue with my body, but through like many years of replacing the thoughts with kinder ones, a lot of it did work. Like just replacing the thoughts did work for the most part for the rest of my body. But I think for my chest, like that was the one place where I was like, I'm just lying to myself. But the rest of my body, I could be like, yes, hell yeah, this is true. My body is great and fine and strong and it's mine. But the chest was like, I'm lying. I'm full of shit. When I was trying to like say, oh yeah, you're lovely and you give me great joy. No, couldn't do it. So
Yeah.
that's the only part that had to go.
Yeah. No, I think like if they gave us joy, right, they might still be here. They didn't.
Yeah.
So it would be dishonest to say like, you give me joy. Do you mind sharing like how do you feel about your chest now?
I would be glad to say that it is designer, gorgeous, stunning, love it. We're best friends. It's mine. Oh yeah, I love it. It's great.
That's really sweet.
Yeah.
I like the best friends.
Oh God, it's so wonderful. I love to just like, I love to touch it and move with it. And finally I don't want to say it, but finally I can stretch it. Sorry to brag. I can stretch it now. I'm sorry.
Oh my gosh. It's okay. I'm getting there. I'm slowly
so
but surely
close.
getting there.
So close.
Listen, I'm going to surpass you soon.
You're going to be an acrobat in days.
I'm going to be an acrobat.
I'll be like, okay. Oh.
Yes, I am famously flexible in bed and in other situations. I'm really not. I'm like the least flexible person I know. One thing that I do sort of take pride in terms of like the functions of my body is that for a time when I was young, in my 20s, I was doing like weightlifting and stuff. And I've always been pretty good with weightlifting. And like I have strong thighs and a strong back that now hurts, but like at the time was like fine. And so I am really looking forward to going back to lifting weights. Maybe not like really, really heavy weights because I don't necessarily want that like bulked up look, but just to really go back to like strength sort of training. And it always made me feel really good. And this is before I started tea. So like if I go back and do weights and lift weights with my new bod now, you know, I might see some changes. I might see some popping muscles everywhere. And did I tell you this already? One of my
What?
one of my like fantasy, one of my hopes, wishes in finally unmasking my true chest the way it's supposed to be is just having really bouncy, nice, you know, like pecs.
That's crazy.
I really want that meaty chest.
I love it.
Even now, I know I'm only like a couple months into recovery, but it does low-key make me so happy whenever I do something and like the little bit of fat that's still around, just like my chesticle area, the sides, the back, when the flesh there jiggles, I'm just so happy. I don't know why.
Yes.
It makes me so happy. And I'm just like, yes, if I build up more muscle, it's just going to jiggle more. I'm going to put all the fat and muscle there, and it's going to look beautiful and sexy. And I'm going to wear a polo shirt.
Of course.
Yes. Who knows? I might get nipple piercing. I don't know.
Oh my
I don't know.
God.
I might go really all the way. Yes. So I might never be as flexible as you are. Okay. I might not be able to stretch better than you, but I can absolutely work on on my chesticles. I don't need to be flexible. I just gotta be that, you know, himbo that I've always dreamed of being.
Yes. It doesn't matter if we can flex. No. Wait, yes.
Flex.
No, it doesn't matter
yes.
if we can stretch. It matters if we can jiggle. That's all that matters.
Yes.
So how many days, months has it been for you post-op?
So it's actually been almost exactly 2 months and 3 days
Ooh.
at the time of this recording.
How do you feel?
Honestly, it feels like it's been longer than that. So I keep feeling kind of impatient over my own recovery process. Like I feel like I should be further along and more mobile. But yeah, I'm trying my best to like stay patient. And with my surgery results, I'm going to be real with you. I'm neurodivergent. I'm not good at lying. I'm not good at like wrapping things up in nice little like gift wrap paper.
Let's get real.
With the surgery like results that I see right now on my chest, I'm about 75% satisfied.
Okay. There
are a couple of things that I'm like really sort of hyper fixated on, and I'm like, why? So I'm just like totally happy I got my top surgery finally, and at the same time a little anxious to be fully recovered and also thinking about revisions. So it's kind of like a soup. Was expecting to be like, finally I'm free, totally. And reality is like somewhat much better than before, but also still some homework left to figure out, you know?
Yeah.
That's how I'm feeling.
Yeah, recovery and like all the healing part of it just takes so long and has so many tiny details along the way.
Mm-hmm.
And as people who hyper focus on things, it's like it's all you can think about, you know?
Oh my God. Oh yeah. Yeah, it's intense. I think it's because there's physical sensation. You know, it's not just about aesthetics.
Right.
The physical sensation is constant, so it's really hard to put it out of my mind or like distract myself from it. I do try to focus on other things. And I think that's like one of the things that we can get into later on about how to take care of your mental health post-op, because post-op depression is a real thing. Mm-hmm. And like I said, you were there throughout much of the process leading up to my surgery and after the surgery. I really appreciated that. And I think it was like really good to have you be present because you've already had the surgery and you're like further along in your recovery process. So probably I'm going to be unloading some anxieties.
Okay. I'm here for it.
And you can give me some wise words and thoughts and reflections as somebody who is further along. in the recovery process.
Okay.
And as somebody who's just like wise in general, I find you to be just like a very wise, calming
Thank you.
human. And yeah, I appreciate it. Let's do this.
Yeah, come as you are.
Always. After having booked my surgery date, I was so anxious and nervous about actually having the surgery that I was like a little bit ignoring like the upcoming surgery. Like I knew it was upcoming. I was looking forward to it, but also like I tried not to think about it too much.
Yeah, I know, and it scared me a lot. I said, Jay, call me right now. You better call me right now.
You were scared by that. No.
I lost my mind.
Right. So you're actually such a calm person. So it's good that like you were the first person to find out how kind of like oblivious. And look, I don't want to like undersell myself. Mentally, I was prepared. Practically, there were some things that I could have definitely started. I mean, like, I don't think that there wasn't enough time to get everything ready because while I was kind of like zoning out a little bit in denial of like all of the prep that I needed to do, you contacted me by chance, like you to talk about something completely different. You were like, "Are you gonna be at Pride?" And I was like, "Oh, I'm going to have my top surgery next week, so probably not."
The way you dropped that on me was ridiculous. Oh, you're like, "Oh, and by the way, I'm just gonna do this big thing we've been planning forever." Like, what? Oh my god, I love that.
I know.
It was so
I've been
casual.
talking about it for years to you. But honestly, I literally told like 4 people, and 2 of them were the people who are going to take care of me post-surgery. So I needed them to know. And then who else? Oh, maybe I didn't tell 4 people. Oh, I told RV, who's been on the show, because I tell her everything. And then you.
Yes.
So literally nobody else knew about this because I was so anxious that like things could go wrong. And then I was going to have to update everybody, you know? And I hated that because I didn't want to like give them anxiety.
Yeah.
So yeah, didn't tell my family, just told you and like 3 other people. Then I was getting my hair cut. I've told you how much I love my hairdresser. I love my hairdresser so much, and she has such a calming presence. Again, like I just feel so healed whenever I have like a session with her. And so I was like calming my nerves, calming my limbic system, just like, okay, it's gonna be fine. It's gonna be fine. Let's just get my hair cut because I'm not gonna be able to touch my hair for a long time after my surgery. And then you text me, and I was like, oh, I'm having my top surgery. And then you're like, what? Okay, do you have... Okay, so like, what's your plan? Who's gonna look after you? What are you gonna do right after surgery? Do you need me to come down or come up, rather? I can take the train. I can take time off work. You cannot go through this alone. And I was like, wow, equal measure moved, touched, and incredibly alarmed. Like, wait, what do I need to prepare for? Because in the pamphlet that the hospital gave me, they said I can go home the same day after my surgery and I don't need a guardian for this surgery. And so I was thinking, okay, I'm gonna stay at the hospital overnight if they ask me to, and then I'm just gonna come home. I'm gonna recover in my little cave and I'm gonna be fine.
And I was like, I disagree.
And you're like, no. Yeah. And I listened to you because you actually went through it and you did it alone. And you're like, I'm not gonna let you go through that alone.
When you called and were like, yeah, I'm getting top surgery, I was exactly like my mother. Like, I am my mother. Like, I heard that and I was like, we have to make a plan right now and I will be there, because that's exactly what she did. But then I was like, no, don't do that. Don't help. But I have a lot of compassion for her now. Feeling that feeling of like, oh my God, you're going to go through this thing and I can't help. And like, you just suddenly want to like spring in to make a plan and like over prepare you, when really I'm just like, I want it to go well. I don't want you to feel that pain, you know? So yeah, it was funny to experience that a little bit on the on the reverse end. I deserved that for what I put her through.
Yeah, no, I think it's I think it was good to have things over prepared. What I ended up doing, because when I told you that I was having my surgery and you were like, "Do you have this? Do you have that?" And it did feel like a lot. Like, and you were like, "I'm so sorry." Like your brain is now like overwhelmed. And I'm like, "Yes." So in response to your concern, your compassion and your concern, what I ended up doing was like over prepare for my recovery. So like I just literally ordered everything you told me to. Or you didn't even tell me to. You suggested some things that might be helpful to me after my surgery, and I was like, I'm ordering that, like everything. I'm gonna put the list
Yeah.
up probably like on Instagram page for the coffee shop AU. But yeah, literally, I made a huge list. I ordered everything. I made sure to have everything also where my arms can reach, because that's really important. You can't like put your arms up over your head after surgery, especially if you have double incision like I did and like you did. So I did that, and I think that was like totally helpful, like for my peace of mind, because I had so much anxiety. I didn't really know what to do with it. And then having something to focus on and not just like, roll around in my anxiety like a little ball in outer space, basically, was good. It was good to have a list and then check things off, feel like I'm concretely preparing for my top surgery. And I think I would have done it eventually, but like probably like with a much shorter time frame. Maybe like I would give myself 3 days and then try to do it all in those 3 days.
You definitely would have.
Yeah, just because like I am a J, like MBTI is like really big in Korea.
Oh, yeah, yeah.
Yeah.
I was like, yes, your name is Jay.
Oh yeah.
No, okay. I am
No,
the J is the
my
correct
MBTI type ends in J, and that's like it stands for judging. And apparently, people who have that trait stronger than like the P trait, which is the prospecting trait, they like to make plans. They like to make decisions. They have to have like all these options, and then they just like gotta have like a checklist. So they need things to be like concrete and set. And I'm like, yeah, that's me. I just go through like a million different like other processes to get there, but I'll get there. On the day of the surgery, I was so nervous and like nothing went to plan, like not a single thing. The chaos I experienced on that day was in some part like it was my chaos, my own internal chaos of being so nervous in the morning that I got all the things ready. I had 1,000 pillows, and some of them were from you because you were sweet enough to like send me some pillows and a bottle of bio oil all the way from Busan to Seoul. And I was like, oh, I'm so moved. This is so lovely. So I'm carrying like a lot of things. And I call a taxi and I put the address in for the hospital. And it shows me that it's going to take me like 50 minutes to get to the hospital. And I'm like, that's really weird because I checked like 3 times how to get to the hospital by car, and it always showed me 30 minutes travel time. Maybe there's a traffic jam. So I get into the taxi, have a really nice conversation with the taxi driver. He's like, are you going to a hospital? And I'm like, yeah, I'm having surgery today. And I was like, oh, you're going alone? And I was like, yeah, but there's going to be people to take care of me afterwards. And I was like, wow, okay. And then he was like, I really hope you have a smooth recovery. I hope your health gets better. I didn't tell him exactly what kind of surgery I was going to get, but he was like so sweet about it. And just like a complete stranger, like ajashi, we've never met. But like that's when I feel my love for humanity just like rekindling a little bit in moments like that. And I was like, wow, what a nice taxi ride. I get off the taxi and I'm like, this is not the hospital that I'm gonna have my surgery at. This is weird. And then I walk around like the whole block because I thought I was just maybe at like the wrong entrance. And then I realized, oh, I'm literally at a different branch of the same hospital. And I need to take a taxi to get to my hospital again. And that was going to take me like 40 minutes. And so that was extremely stressful. There's a word in Korean called menbung. It's short for mental 붕괴. And it means mental destruction. It's a phrase used for situations where your mind literally like shuts down because of how overwhelmed it is. And so I had menbung for like a minute. And then I like got my together. I called the hospital, the right hospital. And I was like, I'm so sorry. I came to the wrong hospital. I'm gonna have to.
But they do have like the same name.
They do have the same name.
The hospitals have the same name, right?
It's literally like one
fair
letter that's different.
Oh, that's very confusing.
And for whatever reason, my map that morning decided to show me the other hospital first. Or I put it in wrong. I don't know. I don't know what was happening. I skipped my ADHD medication because they told me not to take any medication the day before.
We have to.
Yeah. And I was sitting on the toilet and I was like, yeah, okay, let's go. And yeah, my eyes were not working or something. So I forgot where it was. They're like, okay, just get here as quickly as possible. So I take another taxi, and that taxi driver was not as empathetic. A little disappointing.
Aww.
And then I get to my hospital, and of course, like, as soon as I get there, all my shit, like, just spills everywhere, trying to get it out of the trunk, like the handle breaks on my bag that I was carrying.
1 million cute little pillows.
I know, it was all over the ground. And so I forgot to, like, shut the trunk. And the taxi driver was, like, really pissed. He came out, he was just, like, really kind of, I need to go. I need to catch that other call. And I'm like, oh, sorry. So I'm just like trudging.
Sir, you don't know what we've been through.
No way to know. And so at that point, I'm like, my only mission is get into the hospital. Let him know I'm here. Whatever happens will happen. And then whatever happened was like worse than what I was expecting. Because I get to the check-in counter and they're like, oh, okay, so we're gonna book you in for the private room, okay? And I'm like, what? No, I'm not okay with that. I know the prices for all the different wards and I cannot afford the private room.
That's too expensive.
The person at the counter was calling all the different departments and he was like, I'm sorry, there's just no other beds. Like none. And I'm like, holy crap, what do I do? And then, second membung. And then he was like, okay, we're going to check you in. And then we are going to try to find you a bed in, like, the other wards. And I was like, okay, I guess, like, that's the only thing that we can go with right now. In the end, the total cost was, like, manageable because they did end up moving me to the other ward. But, like, still, like, I have literally just arrived and I'm like, my mind is just shattered. And I get checked in and I drop all my stuff off in my room. And then like, I go down to the plastic surgery department and they tell me the surgeon is not there because I'm late. Like she went home. So I'm supposed to get my like chest designed that day. And I was like, what? The actual, just no words.
Wait, can you explain what happens in a chest
design procedure? You know better than me. I mean, my procedure was.
I guess yours was too rushed.
Mine was like 5 minutes. So tell me how it's supposed to go.
Well, I didn't know that we could do all that because I didn't know what it should look like. I was like, I don't know.
She drew on your chest though, right?
So, but yeah, it was the night before.
Okay.
Yeah, it was the night before. I got checked in and then went down there and she took pictures and then drew on me with a Sharpie and did some little notes on my body and then was like, okay, see you. And I was like, great. But like, I had no idea how to explain what I want it to look like. And so you were really good at that. I feel like you were so prepared with like how to advocate for what your body looks like and I wasn't. So I was like, sure. Whatever you want.
Right, a lot of people go into it. The people that I've talked to have told me like, oh, I didn't really have like a clear image in my mind or anything. I didn't really look into that kind of information.
But my way was the wrong way. You were right. No, my way was the wrong way. You were right to advocate for what is done to your body.
Right. I think there's this thing where, and I've noticed this just in general in the queer community, and not just in Korea, just everywhere. When people discuss top surgery, other people's results, their own results, I think there is this tendency to talk about it, unless it's like really obviously very bad. There is a tendency to be quite positive about how you're feeling about the surgery or your results, when that might not be completely accurate, or like there are some parts that you're unhappy with, but people, I find in general, are a little bit more reluctant to discuss those parts openly. And my lived experience is that like you have so much hope for the surgery. You have chosen to have the surgery, chosen like in asterisks because how much of it is really a choice, but you chose your surgeon. You chose this procedure to be done to your body. You're going into it willingly. So I think there is like a little bit of a mental process that comes into like defend you, that decision. So even if you're not completely happy with everything about your results or your surgery, you're more maybe wanting to, yeah, not open up about that so much, at least initially. I do that too. You know, when people that I'm not super close to are like, "How are you feeling after surgery?" And I'm like, "Amazing." There's just like a few little notes that are like driving me actually insane, but I will not say that because I don't want people, especially non-queer people, to think that, oh yeah, so top surgery is actually like super complicated, bad. People should not really get it, or you know, just like I don't want people to have that idea about top surgery, especially if you're somebody who just doesn't know that much about queer stuff. I don't want to leave them with a bad impression. But this other person that I was talking to who got the same type of surgery that I did, you went no nips. I do have nips. This other person also has nips. And initially they were like, I'm super happy. I'm super happy. I'm so like, I feel so liberated. It's so comfortable now. And I was like, oh, great. And then we got a chance to talk more and more about our results in depth. And they were like, well, I feel like my nipples are a little too big. I kind of wish they were a little smaller. And I feel like my scars are a little too uneven. It looks a bit strange to me. And then...
Wait, you said this or they
no,
said this?
they said it to me about their own results.
Okay.
And I was like, oh, right.
Gotcha.
After we had that conversation, actually, they found out that they can have their nipples resized. Like, not necessarily their areolas, but like the actual nipple. And so they're planning to have that surgery later on this year, which I'm really happy about. But they didn't know that they could get their nipples resized. So I'm glad that we were able to talk about that, and then they found out this information. So I do feel like it is important to talk about things that are not sitting right with you about your results, even though the first instinct, I think, is to be like, this is so great, it's so amazing, I feel like so super great, like after my top surgery. Like that is not always the case. And it's okay to talk about the imperfections and like all the feelings that come up. So yes, I did advocate for myself when it came to the results that I wanted, but I still have these moments like now that I've had the surgery and I've seen my result. I have moments where I just go, I should have also asked for this. I should have stressed this point more because clearly it did not get through. But then I think actually there's no way that I could have known then that this is the thing that would be miscommunicated. I just fully like put all my faith in the surgeon because like there's no other choice. It's really scary for me to lose control, especially when it comes to my body.
Yeah.
Especially if you are trans, if you have dysphoria, you're already feeling so uncomfortable in your body and you're giving over control to another human being to make you feel whole in a sense. And that is a lot of power that you're giving over to somebody else. So I think I was just so scared, and I kind of made myself a little smaller than I needed to, I think, in the communication process. I sent also because I missed my chest designing session, like I was just reeling. I was not super grounded. And so what I ended up doing to communicate more with my surgeon, which honestly I probably could have done earlier, but I was just so anxious that I didn't really want to think about it. And I acknowledged that. But I was collecting pictures of chests that I did like the look of and knew that I wanted. all the nipple placements, the contouring, everything. So I collected like 12 different pictures. Also, like after post-op pictures of other people who have posted their things online publicly, I still like cover their faces, but I was like, this is what I love about their results. This is what I don't like about their results. Please, I really want to avoid these and these things. I really want these and these things. And I like did little drawings on my little pictures so that it would be super, super clear to whoever was reading this. Like a 5-year-old could understand this. I just couldn't take that risk of being too like esoteric, you know? So I sent them all over to the surgeon the night before. Right before we had our FaceTime chat, because I was like, I need some grounding.
Oh, yeah.
I need Mo. So, like, we, like, shared each other's window views, like, outside. And we're like, oh, wow,
Yes.
yeah. One of the few perks of being in a private room is, it is really quiet. You can control the temperature of the room.
Yes.
And you have a really nice view outside the window.
Yeah, it looked great.
And also the bathroom was really nice. And you get a little kit with all the like moisturizer, shampoo, you know, toothpaste, and a towel.
Oh my god.
So as soon as I got there, I was like,
okay, business class.
business class, literally. Like, I'm like, I don't even know if I need these things, but like, I'm paying for it, so I'm gonna take it. I like opened them all up, so no backsies, no take backsies. So anyway, I sent all the pictures over.
You showed picture. Oh, you sent the pictures, yeah.
And the surgeon was like, oh, yeah, these are like really helpful. Thank you. And then I was hoping to have a bit more time in the morning before my surgery when she was going to come in and draw on my chest and talk about the design to elaborate further. But she seemed so tired. I mean, like, I knew that she had like a full day of other surgeries. And I'm like, this is where I don't necessarily love my empathetic side, because I feel like I can be a little bit too accommodating at my own expense. And this is one of the few occasions where I feel like I shouldn't let that side of me lead. But I think it kind of did.
Totally.
It like sort of peaked out. And I felt like I couldn't necessarily fully discuss all my anxieties, all the questions that I had, all the clarifications that I wanted to make. I think I got through most of them, but because we had so little time, right now, what I feel most regretful about not communicating further or like making it more clear or being more emphatic about is just like how much symmetry matters to me. And I think what I said was, I knew that like our surgeon cuts, the incision is made, they're sewn up like along the underside of your pectoral muscles, and if they're uneven, like she told me in this design session, sometimes like the muscles are uneven, and then I sort of think about it, and I usually go with like the stitching along the pectoral muscles so that like once it heals up and you like grow out your chest muscles. But not everybody grows out their chest muscles. I just feel like it's kind of important to note that not everybody wants to be like a gym bunny, is it? Or like a muscle queen, which is, I know it can be like a slightly toxic way to put things, but like I'm not opposed to being that. So like,
I know, I love that. We chop off our titties and we're like, oh, I gotta grow my titties
yeah,
back.
exactly. But it's just gonna be like upside down, and it's
so
gonna be so
strange.
sexy. Like literally, sometimes I will look at my good side and I'll just go, I'm so horny. This is turning me on. Like, this is like so sexy. Like, I have always found a more masculine, traditionally masculine looking chest like so sexy. They're such beautiful, beautiful things to me. And like, I always used to cringe when people used to say, like, are you a tit man or an ass man or something like that? You know, like there's the whole thing.
All right.
And it used to make me cringe so hard. And now I'm like, I'm both. Like, I love them both so much. And I've always loved them, just not like, it was just not geared towards like more femme presenting people. But I've always appreciated, yeah, chesticles on masculine presenting folks and their asses, love butts.
I'm a peck prince now.
A peck prince. That's great.
Peck prince.
What I told my surgeon when she told me, I usually just stitch along the underside of the pec muscles, was I actually don't mind just like symmetrical incisions. And she was like, but then your scars will show after you heal. And I said, oh, I don't really mind that. What I wish I had said was, That does not matter to me because it actually doesn't. I want everything to be symmetrical because that matters to me a lot more than the scars being less visible once they heal up. But again, there was no way I could have known that that would be the thing that I'd be like really like uncomfortable with after my surgery, because my subconscious expectation was like things will be even. Those are like the results that I've seen, you know, even if they're not perfect to my eyes, like other people's results that I've seen have been mostly even, symmetrical. So I just thought like symmetry would be built in. But I didn't realize that the degree to which the incisions like get, if you don't ask for symmetry upright with this particular surgeon, how different the results can be. Like, I'm not saying that it's like completely lopsided, but I can see and feel the asymmetry, and that throws me off like all the time. So I think it's good to know exactly what you want, even though it is hard to picture your chest like without the extra lumps on it. Just look at a lot of pictures. Like, if you find something that you like, definitely collect it. Make sure to communicate it with your surgeon. And I would say try to go with a surgeon that like makes space for that, because whether it's like their personality or like the system that they work in, it's not always the case that you get that space to like fully communicate and ask questions to your surgeon. These are some of the hindsights that I have from that chest design session, I guess, which was rushed. And even though I did make a lot of effort to advocate for myself, for my own body, and you were really supportive of that when I expressed anxiety about being able to do that, after having had the surgery and like after having gone in for a few sessions for follow-up appointments, what I'm feeling now as a trans person living in Korea is that it is so easy to put, I guess, your surgeon, the medical staff, the healthcare providers on a pedestal above you, and you're down here and you're very small and kind of sycophantic sometimes. I was like that a little bit, and I don't regret it because I meant everything I said to her. Like, I admire my surgeon a lot for the other work that she does also outside of the operation room. But I think it's important to realize your power and your worth as a human being, but also as basically a client, as a consumer. Like, you are paying for their services and you have every right to ask for your basic rights as somebody who is basically engaging in a trade. Right? For the skill sets that they have. So you deserve to ask for exactly everything that you want. And if I were to go back in time, I would like really tone down that whole like, oh my gosh, you're like basically God, and I'm so sorry that I have to ask you even to like pay attention to these little details because I'm so sure that you know what you're doing, like you're the expert. But actually, like, they're also just people, they're human. And it is so possible that their standards are so different from yours aesthetically and also like just in everything. And so I think it's just with any other social situation that you come across in your life, it's so important to assume that they can't read your mind. They're not inside your head. You've been thinking about this for so long, but to them, it's just like another surgery. So you need to be super, super, super detailed, and don't feel bad about being detailed. Just overemphasize everything that you want, because all the things that I did emphasize to my surgeon before going into surgery in that chest design session is reflected in my results. And so that is why I have this regret of like not being clearer about the whole symmetry aspect that I wanted. Because she did a wonderful job in regard to like everything else that I asked for. She really did. So I know she heard me. It's just, this one thing.
Yeah, I mean, I've definitely like learned, I'm beginning to learn about that from you though. Like, I have just never been in a situation, a medical situation where like I really feel like I'm in charge of my healthcare. You know, I've never felt like, oh yeah, I get to make all the decisions here. Like, I'm always feeling like I am trying to just like be a part of the system and look to the healthcare provider to like make the decisions. So yeah, like when I was talking to you about it, it was like, oh yeah, we should be we should like make this a conversation where I do get to dictate what happens to my body. And yeah, I've learned a lot about that from you.
Oh.
Yeah, I mean, and I'm actually really, really happy with my results. So, like, me not explaining what I wanted, actually, I guess I got lucky because it's great. I'm super happy with it. And yeah, it's
Yeah.
good. But I think in the future, like when I'm in any situation where I'm receiving healthcare, then I'm gonna consider that more and try to be a little bit more in charge. I think it's easier to advocate for others than it is to advocate for myself.
Oh, for sure.
So, like, when we talk about this stuff, I can better imagine helping you or someone else in a hospital get their needs met. But, like, when it's me alone in the hospital, I'm like, people pleaser central.
Oh
I'm
my
like, I gotta
gosh.
do it the right way and I can't bother them. And, like, if I can just survive this discomfort,
Right.
then it's fine. I don't need to, like, and am I allowed to ask for that? And are they annoyed because I don't know what they said to me in Korean? And I'm just, yeah.
Yeah.
Just like the worst version of myself comes out and I'm like, I'll just suffer. But then if it's someone else, it's so easy for me to just like be a monster and like, no, we're doing this, we're getting this.
Right. That is
It's
so
wild.
interesting. Like, yeah, I wonder what it is. I'm sure there is like a whole bunch of stuff in our psyche, that makes it hard for us to advocate for ourselves. But yeah, I think the one thing that I am taking away from this experience, like I guess the less than great parts of this experience from having my top surgery, is just the importance of stepping into my power and taking up space. And it's not just on an individual level, although it is. It is to serve myself, my well being, and my body, which I'm going to live with for the rest of my life. But it is also about queer rights and the queer community. And like how I really want the queer community as a whole to be able to do that. And for us to think that that is normal and natural. And then for the medical world to think that that is normal and natural, because I have noticed a pattern. Well, maybe it's not a pattern, but I have noticed some places where it does feel like the hospital, the medical staff has all the power and they think it's so natural because you're already like the patients that they see are so vulnerable, and so it's easy for them to like give over their power to them, and especially if you're a social minority, then it's even more like yeah, of course you should be grateful like that we're doing this for you, because not everybody does this for you, and like we are like such we're so amazing for doing this to you, for you. um and that is something that I think that is a sphere where like as people who are spending money, and I feel like this is becoming way more like capitalistic than I intended it to be, but whatever, like we live in a capitalistic world. As people who inhabit the bodies that they are going to do stuff to, I do feel like it is within our power to change that stance. Sometimes that can be the case in the medical field. Just by saying, actually, like, you don't get to decide everything. I have information. I have support. Basically, if we exercise a little bit of that care that we give to other people in our community. Like, it is part of community care almost. Does that make sense?
Yeah.
In that by advocating for yourself, you are also advocating for other queer people who are going to be in the same situations as you, possibly with the same people that you're talking to. So that is something that I've been thinking a lot about after my surgery. And I'm glad that at least one person that I really love and care about is taking that away from all the shit that I'm going through.
Hell yeah. No, you're so right. Like self care, self advocacy is community care. It is. And yeah, it is like a ripple effect.
Right. It is the whole
Yeah.
point of our having this conversation for other people to hear as well. So now I'll just like quickly go over my experience of the actual surgery, like the day of, and like the very, very immediate recovery period, which was like all kind of pretty cool. It was chill.
Okay.
And then maybe you can describe what you remember from your own experience, if you remember. Yeah.
Great. Wait, can I pee?
Yes.
Okay.
Do you want to pause the recording?
Yes, because then you're going to have my pee on your recording. So might as well.
Okay. My conversation with Mo will continue in part 2 of Top Surgery when Mo comes back from their pee break. And I know this episode feels like a full episode because I had trouble shaving down some of the things that we're talking about because it was all so good. But actually, there is an even fuller version of it. The subscribers exclusive version of every episode going forward is going to be published a week ahead of each general release episode and comes with a monthly bonus episode. So, if you would like to hear some of the other slightly political, chaotic mess that was happening leading up to my top surgery, and why Mo felt so strongly about making sure that I wouldn't be alone post-op, you can do so by signing up at thecoffeeshopau.supercast.com. I'll leave the link below in episode description. At the moment, we have a single tier subscription package that is going to be available for free until the 31st of October 2024. Then it'll be $750 per month. We came up with this price by taking into account the cost of making the show, and with an eye toward building enough resources so that we can continue to deliver awesome content to you, our listeners, in a sustainable way. Obviously, not everyone can afford podcast subscriptions, and that is totally okay. But if you are able and willing, we would love to have your support. Having you subscribe to our show will also offer us insights on what kind of content you enjoy the most and will help us plan for future episodes as well. Whether you sign up for a subscription or not, we love having you here. We're really glad you found us, and we hope to share many more drinks with you. Thank you for listening. We'll see you in the next one, and until then, stay thirsty.